A trauma patient arrived at the emergency department and quickly being triaged by the medical assistant in charge. The medical assistant triaged the patient and checked patient detail to give reports to the emergency medicine physician. Morning, doctor. Here we have Mr. Naim bin Ali, 36 years old male patient, has fainted during his exercise at home. His blood pressure is 129/90, heart rate 77 bpm, oxygen saturation is 88%. Based on the ECG finding, he got ST elevation.
Alright, thank you.
Emergency medicine physician Munira write a report and inform other department for emergency surgery.
Staff Nurse Naili, this patient need to have plan for coronary artery bypass graft surgery by next week at least, because there are 3 coronary artery block and this blockage are incurable with medications or other treatments. Alright, thank you, doctor.
Nelly is a new nurse at the emergency department and it is her first time encountering such emergency care. She accidentally mixed up patient file and submitted wrong patient file to staff nurse Atika on the planned surgery day.
Atika, here is the report of Mr. Naim bin Ali that will undergo CABG surgery today.
Alright, thank you, Naili.
Staff nurse Atika is about to bring the patient to operation theatre and realized that it was a different patient file. She went back to staff nurse Nelly and clarified with her. She advised staff nurse Nelly to become extra careful and more responsible.
Oh no, this is the report for the kidney transplant patient. How can she miss it? Naili, how come you give me the wrong report? This is not the report for the bypass surgery patient.
Oh my god, I'm sorry, I'm such a careless person. Let me find the right one. I think it's here. Yeah, here. Yeah, this is the right one. Again, I'm really sorry, Atika.
It's okay, Naili, but please make sure don't repeat the same mistake again and be more careful when handling patient report because this is about patient's life.
Yes, I understand. I will make sure this kind of mistake will not happen ever again.
Before entering the operation theatre, there are 3 doctors discussing and giving opinion on the upcoming surgery, which a coronary bypass surgery.
Okay everyone, I'm Dr. Salas and I will be the leading surgeon for our coronary artery bypass graft surgery today. Let us collaborate together to ensure that this surgery is a success, okay? So firstly, I would like to make sure that all of us have fully understood the procedure. Dr. Shakila, can you tell us a short background of this patient condition?
Alright doctor, so today we'll be doing a CABG surgery on Mr. Naim bin Ali. He's a 36-year-old male who was diagnosed with myocardial infarction after he fainted during exercise at his home. So with this surgery, we will be able to redirect the blood around the partially blocked area of his LADA branch, the left anterior descending artery branch of his heart, to improve the blood flow to his heart muscles.
Okay, Dr. Akhil, can you tell me what is the blood vessel that we will use as the patient bypass graft?
We will use the left internal memory artery for the patient bypass graft as it's located near the heart and the coronary artery, and it will be more durable in years after the surgery compared to the vein bypass graft. This procedure involves taking the healthy left internal memory artery from the patient's chest and connect it beyond the blocked left anterior descending artery. And we need to be extra careful with this procedure as the memory artery attached to the main artery, which is the aorta.
Yes, so this means that the bypass grafts are accustomed to a forceful blood flow, and on its other end must be disconnected and grafted onto the diseased coronary artery.
Alright, good. Now I believe all of us are clear about the flow. Firstly, I will make an incision at the middle of the chest to open up the chest. Next, you two will harvest the LIMA to use as the graft blood vessel. After that, our surgical team will place the patient on the heart-lung bypass machine, where the patient's heart will be temporarily stopped during the surgery so that I can perform the surgery on his coronary artery. What will come next, Dr. Akli?
Next, the patient heart will be restarted by clamping off the descending aorta after the bypass graft had been sewn into the right place with strong suture to allow the blood flow to the heart. And lastly, Dr. Celeste will close the patient chest after placing several small tubes into the patient chest to allow drainage of extra fluid from the patient chest.
Alright, it's good that all of us are clear about the surgery. Now we can start the procedure.
During the surgery, an anesthetist is responsible to monitor patient vital signs. A cardiac technician will be monitoring patient ECG and EKG together with a perfusionist. All the indicators are normal.
Patient BP is 71/53, heart rate is dropping, patient vital sign is unstable.
Oh my god. I'm sorry, I might go sleep just now. I think I've cut the small blood vessels there.
Dr. Akli, please beware if you can't remain focused. We are already about to finish this surgery. Patient's life is in our hands.
I'm really sorry. I guess I still feel the lethargic effect from my previous operation. I'm really sorry. I will be more alert after this.
His BP is still dropping. The oxygen saturation level is low. He's in hypoxemia. He needs blood transfusion.
Dr. Shakila, go and get 1 bag of B positive blood in the blood bank stack.
Alright, doc. Hello, good afternoon. I'm Dr. Shakila. I'd like to request a bag of B+ blood stat for Mr. Naim bin Ali. He's undergoing a CABG surgery and he's in need of blood transfusion immediately.
Hello doctor. Yes, sure. You just need to fill in the request form at the blood bank and please double check patient's blood group and hopefully the surgery went well.
Due to the unexpected incident, the patient required blood transfusion. Hence, Dr. Shakila went to blood bank and meet the laboratory officer there.
Good afternoon. Here is the request form for a bag of B+ blood for a CABG surgery patient.
Okay, wait a second. I will get them now. Okay, here is 1 bag of blood type B+ as requested.
Okay, thank you so much.
After hours had passed in the operation theatre, the doctor successfully correcting the vessels and patient is safe and stable.
The blood transfusion is done and the vessel have been correct now. Overall, the surgery is a success. Thank you everyone for your cooperation.
Congratulations and well done, everyone.
The surgery couldn't be done if it wasn't because of the great teamwork from all of us. Thank you so much.
After the successful surgery, Dr. Celeste and Natasha, an in-charge pharmacist, discussed about the suitable medication to prescribe to the patient. Pharmacist Natasha gave her opinion on certain suitable drugs.
Patient BP is higher than normal, but it is common in post-CABG surgery. Drainage volume is at a plateau of 31 ml per hour. Blood oxygen level are normal.
Nice! That means that this patient have no pericardial infusion caused by pericardial inflammation then.
I think we'll need to prescribe beta blockers and ACE inhibitors to reduce his heart rate load and also to lower down his blood pressure.
Yes, and also lipid-lowering medicine to reduce the amount of bad LDL cholesterol and other fat in blood.
I agree. The patient will also be prescribed with aspirin as antiplatelet medicine to prevent blood clots and also to reduce the risk of heart attack.
I think that's all for medication now. My team and I will keep on monitoring closely and I'll notify you if anything goes wrong. Thank you.
With a proper care from the hospital, the patient has been allowed to be discharged after 1 week being admitted.